Hi, I'm Dr. Nanavati. Thanks a lot for joining me today. Today's the first of the year, January 1st, 2019. We're going to talk today about what happens after your heart attack. So you had a heart attack and you went to the hospital and your cardiologist placed a stent. Now, what are the next steps? What do you do when you get home? Well, there's a few things to focus on. First of all, your diet. Your diet has to change. You can't be taking fried foods and high fatty type of foods. So there are diets out there that we can talk about, and we'll talk about what is the right diet for a cardiac type of patient on a later edition. Then also make sure that you follow up with your cardiologist in the next couple weeks, so that he can examine the site where you had your intervention, where they inserted the catheters, whether it be the groin or the wrist. That has to be looked at. Third of all, don't smoke. Smoking is probably the worst thing you can do after a heart attack. The reason being is that smoking increases all those factors that cause the heart attack in the first place. What causes a heart attack is clotting, and clotting within the coronary arteries is what leads to the heart attack. So smoking accelerates those factors. So do not smoke cigarettes. Next, don't miss even one dose of your antiplatelet agents. Invariably, if you got a stent, your doctor puts you on one of these agents. It could be either clopidogrel or ticagrelor or a prasugrel. One of those three agents were probably placed along with the aspirin. You need to take those drugs every day. You cannot miss one dose, because if you miss one dose, it will result in the stent getting blocked off, and that could result in a massive heart attack. So you cannot miss even one dose of those antiplatelet agents. What do those agents do? Those agents basically prevent the platelets from causing the clot. Platelets are little components of blood that basically clump together and cause a clot to form. If the platelets don't function correctly, then the clot doesn't form. So these drugs that you're taking prevent the platelets from functioning correctly. What other things could happen if you're taking these antiplatelet drugs? Well, you have to have precautions, because if you fall or hurt yourself or cut yourself, you're going to bleed more than you normally would, because these drugs don't allow your platelets to work, and therefore you don't clot as easily. Finally, activities. What activities do you do after a procedure like this? First of all, you're able to walk around, especially if you had it done through the wrist. You should, if you had the catheter inserted from the leg, you should not be climbing stairs greater than 6 stairs. At least that's what I tell my patients. You should not generally be driving, because most of the time it's from the right groin, which is your right foot, that is affected. So I would not be driving for at least a week. And so you get a chance to let someone else drive you around, and you can basically have a chauffeur. That's a good excuse. But again, that's only for 1 week. So those are the things that we want to be wary of after a heart attack. So let me summarize for you, as my good friend Tim Russert used to do with his little blackboard. After your heart stent, this is what you need. You need to focus on your diet. We'll talk about that on a future edition. Make sure you visit your physician, your doctor. Don't smoke. I can't underemphasize that. Don't even miss one dose. Even missing one dose of one of these agents can result in a massive heart attack if the stent gets clotted off. Okay? And be careful with your activities at first. Then after you visit your doctor, then you can talk about resuming your normal activities. Thank you very much. Have a great year.